blood, full blood count, and the investigation of blood disease. The simple test is a full blood count, VBC, a full blood count measures the following in a sample of blood: the amount of hemoglobin, the number of the different cells, red blood cells, erythrocytes, white blood cells, leukocytes, and platelets, thrombocytes, the volume of the cells, the erythrocyte sedimentation rate, ASR, a measurement of how quickly red blood cells.
Hi, my name is Marily Peralta. This is my part B, anemia. Anemia is one of the commonest diseases of the blood. It may be due to bleeding, loss of blood, disease destruction of red cells, low production, for example, because the diet is lacking or deficient in iron. A medical student has examined an elderly patient with a very low level of hemoglobin and is discussing the case with her professor. Professor, what's the most likely diagnosis in this case? Student, most probable carcinoma of the bowel with chronic blood loss. Professor, what's against that as diagnosis? Student, well, he has had any change is bowel habit or lost weight. Professor, what else will you include in the differential diagnosis of severe anemia in a man of his age? Student, he may have leukemia of some sort or aplastic anemia, but that's rare. It will be very unusual. Another cause is iron deficiency, but he seems to have an adequate diet. Professor, okay. Now there's another cause of anemia, which I think is more likely. Student, chronic bleeding ulcer? Professor, yes, that's right. But what about pernicious anemia? Can you exclude that? Student, well, he's got none of the typical neurological symptoms like parasite.
Hello, my name is Kimberly Josefina. I talk about pernicious anemia. Jordi Pons, the medical student for Barcelona, has median science language not in his textbook. Pernicious anemia, PA, is a condition in uh, which they atropines the gastric mucosa with consequent failure of intrinsic factor production and vitamin B12. Malabs sporting. The onset is insidious with progressive increase symptoms of anemia. Patients or something say to have a lemon yellow color owing to a combination of pallor and mild jaundice caused by excessive breakdown of hemoglobin because of inefficient self-production in the bone marrow. A restoring tone losses is something present. Patients present with symmetrical parentheses in their fingers and toes early loss of vibration sense, and progressive weakness and axials. The slam may be pulpous. On size, the genes, insidious, slow developing, pallor, lack of colors, meal, slim, audience, Biller begins anemia. Broke down, division in the small parts, bone marrow, soft tissues in the cavity of bones, symmetrials, age says the sinus, vibration sense, ability to feel vibrations, progressive, continue to develop, palpable, palpable, can be filled with the hand.
Amen 15.1 Fight words and the backs when opposes. Miren, look a B and C opposite to help you. Adequate, inadequate. Against for severe meal. Rare common. Insidious setting. Fighting point 2. Make word combination using a word from each, but look at B and C opposite to help you. Bone marrow. Differential diagnosis. Insidious onset. Iron deficiency. Progressiolite. Pernicious anemia. Progressiolite increasing. Vibration sensor.
Hi, my name is Marely Peralta. This is the exercises 15.3. Complete the sentences. Look a E, B, and C opposite to help you. 1. A 39-year-old man presented with a history of progressive abdominal distension over a period of 6 months. 2. Bleediness may be caused by vitamin A deficiency. 3. The bleeding and purpura are caused by abnormal platelet function. 4. The white cell count is normal, so we can exclude acute leukemia. 5. The yellow color of her skin and conjunctivae is provided due to jaundice. 6. There was a palpable mass in the right upper quadrant of the abdomen. 7. Treatment is aimed at restoring fluid balance with adequate intravenous fluids. 8. The anemia may be due to increased red cell breakdown.
Exercise 15.4. Complete the conversation. Look at the C opposites to help you. Professors, what is again the diagnostic of the perineus and anemia in physical examination? Student, the problem is there with the south ill, so it didn't have the typical insidious, or say he doesn't have any sick skin pallor, and he doesn't have symmetrical parentheses or asset vibration saying, and I could feel his explain. What about his long professor's student? He is target was normal and not inflammation or sorry.
Chapter 16 Bones. Bones. Some common English names for bones. English name skull, anatomical name is cranium, jawbone is mandible, spine is vertebral column, breastbone is sternum, rib is costa, collarbone is clavicle, shoulder blade is scapula, thigh bone is femur, kneecap is patella, and shin bone is tibia.
B. Fractures. A fracture is a break in a bone. Some of the different types of fractures. Greetings. Displayed. Cam minaret. In plastic. Cam plot.
Treatment of fractures. When the fragments of broken bone held and joined together, the union may be promoted or helped by reducing the fracture, replacing the fragments in their anatomical position if they are displaced. After reduction, the side movement of the broken bone is prevented by fixation. If they are external, for example, a spleen or sclera or very cast, or internal, for example, a pin or blade and squeeze. A displacement fractures which is not reduced may result in a union, incomplete or incorrect union. 16.1 Label the diagram using words from the box. Look at A opposite to healthy. 1 is skull, 2 is jawbone, 3 is spine, 4 is breastbone, 5 is rib, 6 is collarbone, 7 is shoulder blade, 8 is thigh bone, 9 is kneecap, 10 is shin bone. 16.2 Match the types of fractures. There is a break in the skin, is open, the bone is bent, it occurs mainly in shoulder, is green stick. C is the bone is broken into several pieces, is community. The broken pieces are separated, spliced. The broken pieces are pushed together in paper. Thank you.
Exercise 16.3. Complete the textbook. Extra look at the C opposites to help you. Reduction. Fractures involving training to return the bone to as near to their original positions as possible. If a fracture is allowed to heal in a displaced position, the fractures will unite, but it may go on to malunite.